Hello everyone, this is Mansi Shah, Assistant Professor in the Department of Pharmacology from LG Institute of Pharmacy. So today my discussion topic is about hypertension. So in this presentation, I will discuss with you regarding definition of hypertension, types of hypertension, then symptoms of hypertension, the complications of hypertension, diagnostic test of hypertension, and treatment of hypertension. Starting with definition of hypertension. So what is hypertension? First you should separate the term hypertension, means hyper and tension. Hyper, that is elevated, and tension, that is related with pressure. So in this today's topic we are discussing regarding hypertension. So that is known as raised or elevated systolic and diastolic blood pressure, right? What is systolic pressure and what is diastolic pressure? You need to understand the two terms to understand the term hypertension as a whole. So systolic blood pressure, it is generally noted as a first or top number, and diastolic blood pressure, it is noted as a second or a bottom number, right? Systolic blood pressure is a pressure which occurs during systole, which means during contraction of blood vessels, contraction of specifically ventricles in the heart, and diastolic blood pressure which occurs during relaxation of heart. Okay. The next is stages of hypertension. So first of all, the normal human being has a blood pressure of about 120 by 80 mm of Hg, right? Unit you need to remember, that is mm Hg. Okay, so that is a normal state of blood pressure in human being. Now when it is said to be elevated or when it is said to be higher blood pressure, so for that the categories is high normal, that is when the systolic blood pressure is noted to about 130 to 139 and diastolic to about 85 to 89. Grade 1 hypertension is said to about noted when systolic blood pressure is 140 to 159 and diastolic blood pressure is about 90 to 99. Grade 2 hypertension, it is said to have when systolic blood pressure is about 160 to 179 and diastolic, that is 100 to 109. Now grade 3 hypertension, it is said to have hypertensive crisis. Why so? Because systolic blood pressure raises to about 180 mm Hg and diastolic pressure to about 110 mm Hg. So this is a so much high blood pressure, so which is called as a condition hypertensive crisis, which is termed as grade 3 hypertension. In this condition, immediate medical emergency is declared because a patient may suffer from severe chest pain and sometimes heart failure also occurs. The next is isolated systolic hypertension, that is when systolic blood pressure is about greater than 140 mm Hg and diastolic pressure is less than 90 mm Hg. Now the normal regulation of blood pressure, that is mechanism of blood pressure. To understand hypertension, first one need to understand about the mechanism of blood pressure. So what is blood pressure? Blood pressure is directly proportional or it is equal to cardiac output and peripheral vascular resistance. Now cardiac output means the blood flow or the amount of blood flow, right, in 1 minute, right, from each ventricle, that is said to be cardiac output. And peripheral vascular resistance. Peripheral vascular resistance, which means resistance which is caused by the arteries. Okay, simple example, if you say to take a water pipe, right, and if you push from forward side, right, if the water is coming out and if you push from the forward side, if you keep a thumb and push from the forward side, then the pressure in the pipe increases, right, which explains peripheral vascular resistance. Then for normal regulation of blood pressure, kidney also plays important role, and there occurs local regulation also, right, through baroreflexes. Local regulation is seen through baroreflexes, or you can say that is baroreceptors which are present in heart, right. It is a compensatory mechanism which is activated when some faulty blood pressure is being found, which means when if it is raised blood pressure, then this baroreceptors or compensatory mechanism will get activated and they will try to normalize the elevated blood pressure. If hypotension or if less blood pressure is found, lower blood pressure is found to a lower side, right, then these baroreceptors have a a tendency to increase the blood pressure. In a way, they will normalize or they will regulate the blood pressure in a normal way, right, to a normal range of blood pressure. They will activate sympathetic system for activation of baroreflexes will activate sympathetic nervous system, right, to normalize the blood pressure. The next is renin-angiotensin-aldosterone system, which means kidneys are also involved in regulation of blood pressure through activation of this RAAS system, right? How the kidneys activate the renin enzyme, which activates angiotensinogen, which converts into angiotensin 1, and which is getting converted into angiotensin 2 in the presence of angiotensin converting enzyme, that is ACE, right? Which regulates the amount of sodium levels in the body. If sodium levels are decreased, then this kidney activates renin and then activates angiotensin 2 finally, which regulates amount of sodium absorption and which regulates the blood pressure. So this was about the mechanism of blood pressure. The next is the types of hypertension. Hypertension is divided into two types, that is essential hypertension and secondary hypertension. Now essential hypertension, it is also called as primary hypertension, which is found in about 90 to 95% of cases. Now primary hypertension, it occurs in about 90 to 95% of cases, but the causes are identifiable. Risk factors for this, it can be genetic factor or family history, right? Nowadays hypertension is common in families, so it can be genetic factor or family history. It is can come hereditary. Then obesity. Why obesity? Because it is found that in obese person the volume of tissue is more, right? So heart has to work harder to supply oxygen and nutrients to each part of this tissue of the body. So obesity is related with hypertension, right? This can elevate blood pressure and which can lead to hypertension. And next is age. It is found generalized that when at the age of about 65 or less than 65, they are more prone towards hypertension, and women at the age above 65, they are more prone towards hypertension. Then next is excessive salt intake and potassium intake, lower amount of potassium intake. This both electrolytes that goes together. Why so? Because excessive salt intake can cause fluid retention and which can cause increase in blood volume, right? Now if there is less intake of potassium, then this sodium and potassium will not get bound with each other, and that is why there will be retention of sodium if less amount of potassium is being taken. So this causes fluid retention, increase in blood volume and increase in blood pressure, which leads to hypertension. Next is smoking or tobacco. Consuming smoking or tobacco can cause damage in the arterial wall of heart, right, which can lead to increase in blood pressure and hypertension. Then alcohol consumption, again it causes damage to the heart, arteries of heart. It decreases the blood supply. It can cause plaque formation also, right? Smoking, tobacco, alcohol, everything, it can cause plaque formation in the blood vessels, in the arteries, which can elevate blood pressure and which can lead to hypertension. The next is stress. Stress is now seen nowadays. Lifestyle has become so stressful that this can also lead to hypertension. Right? Now, inactivity and obesity both goes together. If a person is obese, then he is generally found to be inactive. And as I have explained, that obese person have more surface area, so heart has to work harder to pump blood to each tissue, right, to supply oxygen and nutrients. So this can lead to hypertension. Now next is secondary hypertension. It is an elevated hypertension with an exact cause. While in primary hypertension, cause was unidentifiable. Now the causes of secondary hypertension is, it can be renal disorders, endocrine disorders, renovascular disorders, antihypertensive withdrawal syndrome, then drug-induced hypertension, eclampsia or preeclampsia means pregnancy-induced hypertension, then head injuries, burns, and intake of drugs, right? As I've told, the drug-induced hypertension means if there is intake of certain drugs, say for example oral contraceptives, steroids, sympathomimetic amines, then estrogen, cycloserine, then this can also lead to hypertension. What are the signs and symptoms of hypertension? It is generally seen that if a person is in elevated stage of hypertension, which means that if the hypertension is in the range of about systolic blood pressure, say 120 to 129, and diastolic, say about 80 to 89, then these signs and symptoms are not observed. But in cases of severe hypertension, these symptoms are observed. For example, elevated blood pressure causes severe headache, severe throbbing pain in the head. Right? It can lead to shortness of breath, then nosebleeds, flushing, dizziness, severe chest pain. It can cause visual change also. Sometimes the vision gets damaged due to hypertension. Right? Then blood in urine is also observed. Now the complications of hypertension. Basic complication of hypertension is heart attack, stroke, heart failure. Right? This is the basic complication of hypertension. Why? Because high blood pressure can cause hardening and thickening of the arteries, which can lead to heart attack, which can lead to heart failure, or which can lead to stroke also, right? Because of thickening and hardening of arteries, the blood is not getting easily supplied to the brain, and this can lead to stroke. This can also lead to dementia, right? Which is in the next slide, which is present in next slide. Okay? So this is a complication of hypertension. Then next is aneurysm. Now, increased blood pressure can also cause your blood vessels to weaken and bulge, forming an aneurysm. If an aneurysm ruptures, it can be life-threatening. As I've said that kidney is involved in mechanism of regulating blood pressure, so hypertension can cause weakened and narrowed blood vessels in the kidneys, which can damage kidney, which can damage the function of kidney, right? Then narrowed, thickened or torn blood vessels in the eyes. As I have said that hypertension can also lead to sometimes vision loss. Then metabolic syndrome. Metabolic syndrome means when a patient is having hypertension, then doctor tends to measure him blood test, and in that triglyceride test is being done to assess the levels of, and cholesterol test is done to assess the level of HDL, LDL, and triglycerides in the body. HDL, which means high density lipoprotein, which is a good cholesterol, and LDL, that is low density lipoprotein, which is bad cholesterol. So if in the body the amount of LDL increases and HDL decreases, then this can lead to metabolic syndrome. Sometimes hypertension can also lead to diabetes, right? When there is increase in the amount of insulin levels. The next is trouble with memory, understanding, or dementia. As I have told, that narrowing of arteries or blockage of arteries can lead to dementia, right? As this can decrease the blood flow into the brain, and that is why dementia occurs. Now this next is the diagnostic test for hypertension. First is treadmill test. Now in treadmill test, what happens? A patient or a person is made to run on a treadmill, and at a specific time the elevation of blood pressure is being noticed, and at the time at which that elevated blood pressure gets regularized or gets normalized, right? That is being assessed in treadmill test. The basic point or basic thing behind recording is that if the patient is under stage 2 hypertension, then he will not be able to run anymore on a treadmill test more than a minute, right? And immediately he will feel uncomfortable in treadmill test. That is why it is told that a patient suffering from hypertension should not do more physical exertion. The next is repeated and reproducible measurements of elevated blood pressure. Right? This is being done to assess the blood pressure, because if a patient is having blood pressure, higher blood pressure, that is elevated blood pressure, the regulator at regular intervals, the monitoring of blood pressure is being done. Right? It is being done in a day, in a week, right? To adjust a dose of medications. Then next is blood test, including the measurement of electrolytes, blood urea, nitrogen, creatinine levels to assess kidney involvement. Then lipid profile test, as I have told, that amount of HDL and LDL is being assessed. Then specimen test for hormones of adrenal gland or thyroid gland. Then urine test to assess electrolytes and hormones, that is sodium and potassium and many more electrolytes is being assessed. Excretion of electrolytes is being assessed in urine. Then electrocardiogram, that is 12 lead electrocardiogram is being done to assess that whether the function of heart is normal or not. Echocardiogram is also done. And finally, ultrasound of kidney and CT scan of abdomen is being done if there is any damage to the kidney or if there is any damage in the adrenal gland, right, to assess that this test is done. Now the treatment of hypertension. Basically the hypertension is being divided into two types of treatment. The first is non-pharmacologic treatment and second is pharmacologic treatment. Now non-pharmacologic treatment means eating a healthy diet with less salt, right, then exercising regularly, then maintaining healthy weight or weight loss regimen is being given to a patient, right, then limit the amount of alcohol or limit the amount of smoking. This all comes under non-pharmacologic treatment. Now under pharmacologic treatment, that is medication treatment. The first basic treatment is thiazide diuretics. For example, hydrochlorothiazide, chlorothalidone, indapamide. The basic motto behind this thiazide diuretics is that it helps to eliminate sodium in water and reduce the blood volume. Okay? The next is potassium sparing diuretics, that is spironolactone and amiloride. As the name suggests, potassium sparing, which means that potassium loss is being stopped. Okay, potassium sparing means to spare the amount of potassium to prevent the loss of potassium. Potassium diuretic is given and it is generally given in combination with thiazide diuretics. The third is angiotensin converting enzyme inhibitors, that is ACE inhibitors. As I have explained in the renin-angiotensin aldosterone system, that through this system angiotensin 2 is getting activated and from that sodium reabsorption occurs, which helps in regulating the blood pressure, right? So ACE inhibitors is given if there is excessive amount to stop excessive amount of sodium reabsorption, right, to decrease the amount of hypertension, right? For example, here the example is lisinopril, benzapril, captopril, enalapril, ramipril and fosinopril. All the prils are ACE inhibitors. Then next is angiotensin 2 receptor blockers, that is ARBs, right? Here you can remember as all sartans are angiotensin 2 receptor blockers. For example, candesartan, losartan, irbesartan, valsartan and telmisartan, right? The next is calcium channel blockers. Calcium channel blockers, the name itself suggests that it blocks the amount of calcium ions, it blocks the amount of influx of calcium ions into the heart so that it becomes easier for the heart to pump, right? Example is verapamil, amlodipine, diltiazem, nifedipine and felodipine. The next is alpha-adrenergic blockers. For example, doxazosine, prozosine, terazosin, phentolamine and phenoxybenzamine. Now the mechanism of this is alpha-adrenergic blockers, they lowers the blood pressure by keeping the hormone norepinephrine from tightening the muscles in the walls of small arteries and veins. As a result, the vessels remain open and relaxed. This improves blood flow and lowers blood pressure. The next is beta blockers. Now, for example, is-butalol, atenolol, propranolol. These are the examples of beta blockers. The beta blockers act by blocking the effects of hormone adrenaline, which reduces the workload on heart, right, and which opens the blood vessels, so causing the heart to beat slower and with lesser force. The next is alpha plus beta blockers, that is alpha beta blocker combination, right? For example, carvedilol and labetalol. Now, alpha plus beta blockers combination, they are used to reduce the impulses to blood vessels, right? So, alpha beta blockers lower the heartbeat to reduce the amount of blood that can be pumped through the vessels. The next is renin inhibitors. Example is aliskiren. Here, renin inhibitors, as the name suggests, it inhibits the amount of renin, an enzyme which is produced by the kidney, right, which regulates the blood pressure. So, it lowers the amount of renin. The next is vasodilators. Example is hydroxyzine and minoxidil. It works directly on the muscles in the walls of your arteries, preventing the muscles from tightening and your arteries from narrowing. Now, the next is central acting agents, that is clonidine, guanfacine and methyl-dopa. This acts, they give signals to the brain to regulate or to normalize the increased blood pressure, right? That is, they activate the sympathetic nervous system to regulate the blood pressure. Thank you so much.